I find that the shared stories, the shared experiences is incredibly powerful. So women in the audience can see other women, how they lead, they can learn from that. They can learn examples of how women lead, which I do think can be different. And it's quite inspiring to see someone that you can relate to in a rather personal way, and then you can say, I can take some of those tricks and maybe I can use them, or maybe there's somebody I can reach out to for help. There's just a lot of barriers that aren't there when it is women in the room.
When was the last time you were in a room with this many women leaders?
I think it's been, I'm not sure I've ever been in a room with this many women leaders. I happen to go to a women's college, so we might think that, and those women went on, many of them, to be leaders. I went to Wellesley College. So I'm sensitive to that atmosphere, and I can just say it's a pleasure.
Well, I want to be respectful of your time, so thank you very much.
Sure.
Good luck getting
Thanks.
started, and lovely to meet you. So just quickly introduce yourself for us.
I'm Michele Berry. I'm the director of Stanford Global Health here.
And how does it feel now to have your dream realized, a few hundred women gathered to talk about leadership?
I can't tell you how excited I am and how many amazing women are at this conference. But to me, what was so important at this conference were the young women's voices. We had a panel with lightning rounds where young women got up there and talked about their work for a second and then said why gender mattered. And I have to say, it put tears in my eyes.
And the excitement feels palpable. I've already interviewed people who said, because of something I heard at 10 o'clock, I'm going to start a mentoring program.
Fantastic.
And I've heard lots of thoughts like that. One thing I'm asking people is, this is the first conference. There'll be another one next year in London. What hope do you have that something could change by then?
It's going to be an ongoing process. I don't think you can change a climate or a culture that quickly. I'm thrilled that the London School is actually doing the conference next year. It looks like Agnes Bingawaho wants to have the third conference in Rwanda, although there's a little fight. Thailand wants it and Kenya wants it. So
that's not bad.
We'll see where the third conference lands. But the main thing is to keep the visibility of women leaders up there and to keep the discussion going.
We have 20 men here too as participants and as attendees. How do you feel about that panel discussion about their role in this fight?
I think having men participate in the conversation is crucial. I think we need to engage men to make a difference, but I also think you need to give visibility to women. So I think next year, hopefully we'll have more men involved. And not hopefully, I mean, we could have actually gone out there and recruited men, but I think we need to get our ducks in line. And I think that's what this inaugural conference is about.
Tell me something else you've heard today that really struck you.
There's so many things that struck me. I think the discussion about sexism and racism was really important, and how do we work on both at the same time. I think the comment about gender being fluid, that it's not only about women, it could be about other people that identify as women or anything in between. I think we need to engage all those folks in the conversation about underrepresented people in leadership.
And you know, some of the stats we've been hearing, they are quite dismal and they feel depressing. Do you have hope that things can change in our lifetimes?
I'm raising 2 daughters. It better change in our lifetime. I'm very encouraged the fact that Tedros has half of his cabinet as women. But I'm now thinking that as more of us senior women move into leadership roles, that we need to start focusing on what I'm calling the mezzanine level, the level below the glass ceiling, and really mentor and sponsor women at that part, at that time of their career.
You're very deliberate about lifting other women up, especially young women. I've noticed that in the 4 weeks that I've known you. You've pulled me into so many things. It's really inspiring. How do you say to other women in your position that they can do that if they're not already doing it? Do you have advice about how to go about it?
I think when you reach a certain stage in your career, you start thinking outside of yourself. And hopefully that starts at a younger age, but it is a kind of dog eats dog route sometimes in the academy and in academic medicine. So I put the responsibility, it's on my watch now that I'm at a leadership role, that I need to mentor women. And I expect that of all my peers. And frankly, all the women I know do that. Yeah.
It's inspiring. Thank you.
You're welcome.
Thanks so much, Michelle.
So it's lovely to meet you here. Can you tell me your name and where you've come from?
I'm Kelly Creamer. I came from Seattle, Washington.
And what do you do in Seattle?
I work for the Chatham House, and I developed a new West African Global Health Leadership Fellow program. So we have 2 of our fellows are here. They're doing the lightning rounds to present the research that they were working on for the last year, and they're sort of emerging leaders in global health. One is from Ghana and one's from Nigeria.
How does this compare to other global health conferences that you would normally go to?
Well, all women.
Yeah.
Which is, very exciting.
Well, they've let 20 men in, but it's still a smattering compared to what we normally see, right?
Right, and talking about the issues that women face, as far as like certain things where there's risks that men don't have, and so it's just kind of that, just to bring it up in the open and to make it okay to have that discussion and to realize that we do need to keep having those conversations, and no matter where you're from. There's always, women are always going to face different challenges and risks, and so it's like great to have the discussions.
It's still early in the morning, but is there any particular thing so far that's really resonated with you?
For one is the resilience conversation this morning. I'm on the board of directors and a program chair for a nonprofit where I live called Raising Resilience, and it's a parent education program. And so that was just interesting to talk about the resilience and how, we are just so strong, and you just sort of come back, and that's just so important, especially when thinking about women around the world and how, again, like the risks and challenges and how we bring each other up, we bring the children along, we bring others, we're just collaborative, and it's empowering.
It is. It's exciting as well to hear it, and a whole day focused on that.
Yeah.
What do you hope to get out of attending the conference today?
Some of the networking, so more leadership. I'm excited for the breakout session on voice and leadership. I get nervous, as you can tell, talking about issues and
doing great.
So that's one of it. Is just sort of that leadership component and how to rise up, how to tell the stories, how to and where opportunities and networking.
I would say you're a natural.
Oh.
You're really good. Thanks so much for talking to us.
Thank you very much.
You're one of few men at a Women Leaders in Global Health conference. So what brings you here?
Well, look, this is a critical question facing the world and global health in this context, and I think to be part of this conversation, to be around this extraordinary group of leaders and engage on how do we move this forward as kind of a movement is critical. So I was delighted to be part of the conversation.
What's PATH doing to tackle this issue?
Well, that's a big question because we're actually quite engaged on many different levels. I guess at the core is PATH's mission, and for 40 years, but we've sort of reestablished that we're really focusing on how to accelerate innovation to address inequity in health, but particularly around women and children, and that's where the most vulnerable. So from a larger scale, our mission is centered around that topic. But then when we get into how do we do that, and what are we doing to ensure that the women who have ideas and insights and leadership and skills can be really the driving or being part of that, we're doing a variety of things. Everything from ensuring that as we hire and develop people, we have about 1,600 people around the world, that we're being quite conscious about building more technical and leadership capacity across gender and across a variety of different boundaries. And the majority of our employees are women, and we have more and more women throughout leadership. In fact, it's very balanced. But I think more intentionally, it's we need to commit to doing more around listening and unconscious bias and management of unconscious bias, and we've started talking about that as a cultural aspect. And then finally, I would say we're quite focused right now on what can we be doing to actually get to the gender issues in our work. So that's everything from maternal immunization. This is a really tough issue, and there's lots of embedded bias into why we should do that. Where are we going with cervical cancer and women's cancers, and why are these not getting the attention they should? There's a whole host of issues like that PATH's trying to push.
As one of only 20 men in a conference with a few hundred women, what do you hope to learn today?
There's so much opportunity today to learn. I hope to hear more what the sort of experiences people are having and how I can either as a leader or as an individual contribute to mitigating or changing those experiences if they're negative. I'm most interested in learning less the problem. I think the problem statement's pretty clear, and we're spending maybe a lot of time on that. But I think now moving to, okay, what it is that we can sort of tangibly grab and do. What are some sort of either at the big idea, the movement, the message, the larger agenda, or even small, more nuanced, oh, I hadn't thought about that, or maybe I should try a little more of this. And I think some of the conversations I've had will get more to those.
Okay, so get more into the weeds of that.
Yeah, and also, what are some of those things that other people might be thinking about or doing, or what are some things that the commitment that the globe is making, how can we translate that into our work, or how can we be enacted? I want us to be very engaged in this movement.
That's reassuring to hear. And can you tell me one thing you've heard today that's really struck you?
Well, I got to tell you, there was a comment about the perceptions that McKinsey on the McKinsey report. I think somebody mentioned that how men perceive enough women in leadership and they're not, and that's. So I think some of that. I don't think this is going to get answered through being a complete geek around numbers, but I actually think we're learning a lot about where the biases are and how perceptions work, and honestly, and there's some also good work actually coming out in this instance from McKinsey, but many others on many organizations of all types are struggling with this same issue. And so, and some of this interesting work that's coming out on, not only perception and bias, but also on, things like that it is actually at that first career step where most of this starts happening. It's not, we think, well, why are women not being put into the final top leadership role? Well, that actually isn't where that decision really was driven. It was actually early on we start segregating and we start reinforcing and we start. So that message, that learning that somebody had me read this morning makes me think about, it's not just, okay, who do I pick to be the senior leaders, but how do we ensure that from the day we hire someone, we're starting to think about conscious or unconscious ways to address their sort of equal development.
Yeah, those inequalities are formed really early.
Yeah,
I would say from when
incredible.
we're girls.
Yeah,
It
yeah.
develops. So this is the first conference. We're going to have another one this time next year.
Yeah.
What do you think could change by then?
Well, I think if we could, work to come out with one or two ideas from this conference that we could move forward as a community, and that might be, some intentional mentoring model, some intention around, helping support the new leadership in WHO to be more aggressive on this issue. I think picking a few things that are timely and actionable would be great. I do think it will be great to move the conference to here's the challenge, to hear our, there's always this sort of back and forth between the problem statement and the solution statement, but moving it along toward, okay, can we get some momentum on a few big ideas and some small ideas? And then I do think it's very possible to engage even a broader group of people, maybe more men, but I don't think that's the objective. It shouldn't be the objective, but I think we'll learn a lot from this conversation that we can shape the next conversations.
Well, thanks for being here and thanks for talking to me.
Yeah, well, thank you for doing this.
Thanks. Steve. Could you start by just telling me your names and where you've come from and what you do?
Okay, my name is Gertrude KABANYOMOZI. I'm from Fort Portal, Uganda, belong to the religious order of the Teresa Sisters, and I'm on the leadership team. I also coordinate the WATSI project that's about helping people with low income to have curative surgery support, supported by WATSI, an organization here in San Francisco.
Excellent, thank you. And
You're welcome.
I'm called Sister Dr. PRISCILLA Busingye. I'm an obstetrician and gynecologist. I came through the Michigan partnership that we have when they said there's global leaders, women meeting, so it was a pleasure to come as a woman, as a medical director of the hospital, and also most of my time I'm engaged with women, fistula surgery, very poor women with very hard background and very touching stories. So I just felt, let me come, you never know, we might pick words of wisdom as women lead from these women leaders also to take back home.
favorite thing about the Women Leaders in Global Health Conference so far?
Actually, it's been everything almost have been very interesting, but the key thing is just to see how we need to bridge this gap that has been there between men and women, the inequality, so that we can walk on the same footing. And the most important thing is that to realize that we need each other in order to move things. Yeah.
This is the first conference, and there's going to be one next year. Do you plan to come to that?
I wish we would get funding. That would be great to get funding and come, because it was from the generosity of Michigan Dean of Students that we were able to come.
So between this conference, the first one of its kind, and the one next year, do you feel that anything can change?
Actually, personally, I'm waiting for the last remarks. After all this talking, what next? What is there that we are going to do? What are the working points? What are the action points that we all need to do? So that it can inform the next. That next time when we come, God willing, we can have really practical things today. From the first women's conference, we did this, we did this.
So you want to see action items? Yeah, I think we all do. I think we all do.
Yeah.
And is there anything that you've seen this morning that really struck you?
One thing, there is one comment one of the speakers gave was like if we could also engage more men than the men with the number of men we had today. And for me, that one struck me, because it's like now we are talking behind their backs. If they are there, they can also know what our challenges are, and together we move forward.
Okay.
Mm-hmm. And the good thing is that the men were able to appreciate that they are all mentored by women. That was very good. That was powerful. That was powerful.
Is there anything you've seen just in the first half of the day that makes you think, oh, I'm going to try something different, or I'm going to try something new?
There's this lady who came up with I think it was 6 points. And she said, number one, don't be afraid to be the first. So it's like it wakes up you from all the dreams you have had and say, why don't I go ahead and think about this, say my point. You never know what can come out.
Yeah, thank you so much for talking to us. Can we hold you for another 30 seconds and just try to do a really quick video on a phone? We'll just try it out. Is that okay? Because they also want to put it on social media. Wow. If that's okay, and it'll be awesome to have you guys.
No, let's do it. Can you also tell us your names and where you're from again?
Oh, my name is PRISCILLA Busingye. I'm an obstetrician and gynecologist working in Uganda, in Fort Portal, in VIRIKA Hospital.
Thank you.
Yeah.
I'm Gertrude KABANYOMOZI, also from Uganda, of the same order with Dr. PRISCILLA, the Teresa Sisters, or Daughters of St. Teresa of the Child Jesus. I'm on the leadership team of that order, and I'm also coordinating the WATS program that gives helps to pay for surgeries for people with low income at VIRIKA Hospital where she works.
My name is RUANNE Barnabas. I'm a South African. I'm based at the University of Washington in Seattle, and I work on HIV treatment and prevention interventions, mostly community-based interventions, so embedding science within the community to work on empowering people within the community to understand HIV and take action.
Excellent. And Ruanne, what motivated you to take time out of your busy schedule and come to this conference today?
No one works alone. I work in teams, I lead teams, and I would like to pass on leadership attributes and figure out how our teams work better so we can have a bigger impact, and also to have many more people working on this. I hope that the young people that I work with will also become leaders, and this amplifies the effect of having community-based interventions to prevent and treat HIV.
I like that word amplify, and I feel like a lot of women have that mindset of not just climbing themselves but lifting as they climb. Is there anything this morning you've heard that kind of really resonated with you or excited you?
When Glenda Gray talked about how she prioritized providing grants for women and for African scientists, I thought that I should really step up and purposefully mentor more women, and especially in health economics and math modeling, which is where a lot of my research is in, to prioritize having women who have those skills and undertake those kinds of projects. So we have the next generation of scientists also have many women represented.
So does that mean that this conference might spur a new mentoring initiative for you?
Yes, I think so.
That's really exciting. Yeah. Well, thanks for taking time out of the schedule to talk to us.
Yes.
Thank you. It was
my pleasure. Very nice to meet you.
We'll see you around.
See you around.
Thanks.
MOSOKA P. FALLA. I've traveled from Liberia. I wear multiple caps in Liberia. Currently, I'm the Deputy Director for the National Public Health Institute. It was started right after Ebola as a kind of a Liberia CDC. I also serve as a principal investigator for the Ebola studies, and I have an NGO that addresses maternal child health issues.
And what brings you to a conference about women leadership, women and leaders?
Probably one thing that I've gotten it, and I'm a big proponent of women leadership. You know, in Liberia we have done an experiment. We have a woman president, and I think it's worked well. Some of us are supporting the initiative that women can play good leadership, and so I got an invitation through a mutual friend, Anne-Marie Kimmel. We have worked on a couple of global health issues. She thought maybe I got it, so I could be present and motivate other men to support women.
And what's your role? What's the role of men in increasing the number of women in global health who hold positions of power?
So, from the Ebola until present, what I've really consistently done is to work with women, identify potential women, and work very closely with them. As a matter of fact, we started an NGO during the Ebola to mobilize community called Community-Based Initiative. It was started by me and two other female medical students. One of them was in the US recently as a Washington Fellow. So I've done that job over and again, identifying potential young women and mentoring them to the point to take leadership role. So I've seen that as a way, and many of them have actually transformed our organization. So I consistently do that, giving them opportunities, linking them with other leaders.
So you've seen change in your organization because you've included more women?
Yeah, as a matter of fact, as Ebola was winding down in 2015, I got an invitation to come on a speaking tour to the US. And we had a very complicated organization with 5,700 employees. And who did I leave when I left was a female. After about a month of speaking tour in the US, I got back to Liberia. She said, "Can you take back?" I said, No, you've done a good job. I'm not going to sit back and let you run the show. So I've clearly seen a transition. And the go ahead, she took over the organization, ran it effectively until she was ready to go back to medical school.
Yeah, we do well when we're given those opportunities.
The opportunity, the support. And when I try to tell the female that work with me, you got to stand up and speak like you are equal. So I always encourage them.
In your country, where the highest office in the country is held by a woman.
There's a woman, and my two other bosses I have are women, and the Minister of Health that I closely work with is a woman. The President of the University of Liberia is a woman, and they are my leaders. I take instructions from them, we work together, so I've seen it work very effectively.
And what do you hope to get out of coming to this conference?
This is a movement. This is like all movement. This is the gathering of highly influential women coming together and say, it's about time we shift the paradigm. It's about time we take our rightful place. And then trying to invite the men so that together we can begin this movement. And I begin to think that this is going to multiply itself. And leadership will look at in many dimensions. And just as we had the women rights movement. This is a big movement that's going to say women need to take their rightful place in global health. That's what I think is going to come out of here. And I'm going to be an ambassador of that.
Happy to hear it. Thank you so much for your
Welcome.
time. Lovely
Thank
to
you.
see you. So we're only a couple of hours into the conference, I know, but is there anything that's like really resonated with you so far today?
I really like Professor Jennifer from Harvard who took the session, and the point she raised about, you really need to feel good about yourself and, to know what you actually stand for as a leader. And rather than having some, preconceptions, we need to fight, and also always fight for others. That makes you leader and empower you and others around you. That was quite inspiring. And the way she told about the core characteristics of a leader and how to be resilient in this turbulent times we are living in, as we all know, and how to care about, how to build trust. I really like that, her views about that, how to build trust in others from different nationalities, diversity, and work toward for the welfare of others, and how women can do that.
She raised really useful points, didn't she? You almost feel like, I can start using that straight away.
Right.
Is there anything else that excites you?
You could actually relate to it because, in life, when many a times we all have those lows when you try to quit. Well, is that the time? And that's when she told how we can still have faith and build the trust in humanity and build a trust among women leaders, and come together and fight for what we believe in, and we should all have a passion to work on that.
What are you hoping to get out of the conference?
Well, specifically for me, I'm in a very male-dominated field and have been my entire life, and I feel like it's a lot of affirmation and confirmation of women, and that they need to sort of step outside of the roles of being sort of modest and always respectful and polite, and how best to do that while maintaining our gendered identities as well. I think that's really what I'm hoping to get out of the conference, is how to balance these sort of identities of being a leader and also being a woman in society's framework.
And what breakout session are you signed up for?
I'm in the politics one because this administration has definitely increased some very eating habits, and so
you're not the only one.
So I'm really trying to cope with it. So hopefully this politics breakout session will be really good.
And what are you guys hoping to get out of the rest of the conference?
I'm just loving the energy in the conference, and I really love the kind of action-oriented aspect of it. So one of the speakers that's resonated with me so far is Glenda Gray from South African Medical Research Council, where she talked about how there's been this progress from grants being given to predominantly white males to predominantly African, and now 50% women, and she wants her replacement to be potentially an African female, which is fantastic, and that's kind of the progress that I think that an event like this generates. So I'm really looking forward to that kind of next step that we're going to go to.
Does it push you to do anything differently in your own life?
Absolutely, absolutely. I mean, I think that's sort of, I'm part of Women in Global Health, which is the implementing partner for this conference, and I think that's one of the reasons that I joined, because I want to see a more gender equal world. I want to be seeing women like myself in leadership positions. They're the women I aspire to, which is I think why all of us were fangirling with Dr. Sanya Nishtar, because she is a woman we can see ourselves as. She's, she looks like us. She's just inspiring. Yeah.
Well, thank you for your time.
We'll
see you around. Enjoy the conference.